All right, in this video, we're going to answer the question, will fiber bump you out of ketosis? Okay, I get this all the time. First of all, let's talk about what a fiber is. A fiber is actually a carbohydrate. However, it has no effect on blood sugars or insulin, so it's low on the glycemic index, okay? Fiber basically feeds your microbes, your bacteria in your gut, and your microbes then give you back butyrate or butyric acid, which then feeds the colon cells energy. So the colon cells actually take that and they use it as food to function correctly. Also, butyrate helps blood sugars. So it can help lower insulin indirectly. So it does have a positive effect on your blood sugars. So when I say it has no effect on the blood sugars, I'm talking about it has an indirect effect down the road. Okay. All right. So here's the problem with fiber. It can cause retention of fluid. Some fibers are soluble, some fibers are insoluble, and basically certain fibers tend to gel, and that can actually expand in your gut, and you can feel like your belly swelling, like you gained fat, but actually it's just water weight, okay? Now, if you have SIBO, small intestinal bacterial overgrowth, I put a link down below. This is interesting because this condition is a situation where you have microbes growing in the small intestine where they should be growing in the large intestine. If you consume fiber, especially large amounts of fiber, and feed these microbes, you will get some pretty severe gas. You might really feel distended and bloated and feel like you just gained so much weight. Just realize that's gas, not necessarily water weight, but it's gas, okay? So if you get worse on too much fiber, then check for SIBO. I have a video on it. So in certain individuals, especially if they have a history of antibiotics, have damage in their colon. And so if they do too much fiber, it irritates them. So we have all these different reactions that can occur with fiber. It could be past damage with your digestive tract. It could be that you don't have the microbes to handle the fiber and you have to go slowly. So you really just want to test the waters and see how your body reacts to fiber in general. I always recommend 7 to 10 cups of salad or vegetables per day. Now, I recommend the salad be raw, but the cruciferous vegetables and some other vegetables like onions, for example, saute or slightly cook those because that way they are easier to digest. You wouldn't want to consume raw Brussels sprouts because it can be really hard on the system. Your body just can't assimilate that. But maybe sometimes kale would be fine or cabbage in a salad. But for myself, I cannot do broccoli raw. So test the waters. If you feel good with a large amount of vegetables, then you're fine. If you don't, cut back, slowly get into this. But if you start gaining weight on vegetables, we know it's water weight, okay? Now, will this extra water weight and this bloating knock you out of ketosis? Potentially it could temporarily, but it's not from the carbohydrates, it's just from the stress of feeling bloated. Now, when you look in the back of the label, nutritional facts, you'll see that some foods have carbohydrates, okay? And then some foods have fiber. You just basically deduct the fiber from the total carb to get your net carb. And that's what you're operating off of when you're doing ketosis, where you want to keep your carbs to 20 to 50 grams or less. I don't recommend counting the vegetable carbohydrates, okay? I don't recommend counting the salad. We want you to increase that because there's so much fiber and it has barely any effect on your blood sugars. I would not worry about that. Now, some other fibers that I want to bring up, chicory root, which is inulin, is in a lot of keto-friendly snacks and chocolate and things like that. Then you have something called fiber yum. The name for that is isomalto oligosaccharides, IMO. They call it a fiber, but there is some glucose and a few other sugars in there. So it can spike the sugar a little bit. It's not just pure fiber. And so if you're going to consume this, just do very small amounts occasionally. And then you have corn fiber. You want to make sure that this is non-GMO, but they're starting to use soluble corn fiber more and more. Then you have gargum, which is a thickener in a lot of different products. So realize that these fibers that are in a lot of your foods tend to upset your GI tract simply because the interaction with the microbes. So Be careful about doing too many of these if you're doing keto, because it can be the reason why you have either diarrhea or constipation. All right, guys, thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.